if the Democrats want to hold on to their majority, you're going to have a problem. Because if you pass this and nobody gets insured by 2013, you're going to have all the boogeymen out there, death panels, you know, abortion, rationing, you can't see your doctor and all this stuff. And you're going to have nothing in anybody's experience that counteracts that. I think what you ought to do is open up Medicare for people who are over 50 as a public option. Let them sign up. You have to change the rates, of course. You can do that. That's easy to do. But then that's the only way that you can deliver health care to anybody by 2010. You need to have people signing up for this program by no later than July 1st of 2010, preferably June 1st. The only system that you can do that with is Medicare. You can't invent a new bureaucracy run by HHS, which has never run a bureaucracy like this, and then expect it to work in any reasonable way. So if the Democrats finally figure out that they want to survive the midterm elections, their public option will be allowing a certain proportion, whatever you deem appropriate and financially viable and yet politically viable. You've got to have a certain mass, but not so many people that you can't manage the system. And you'll figure out what the right premium is, and that's all the CBO and people like that will figure that out. But I would strongly advise that you use Medicare as the vehicle so the president can sign the bill in December, and it'll be opening and operating, or at least part of it will be, in July of 2010. That's the only way you definitely preserve your majority. Because once you get people who are actually insured, all the myths go away. And I've experienced that in my own political life in an unrelated issue, where you pass something, everybody thinks we're all going to go to hell in a handbasket, and all of a sudden it goes into effect, and nobody notices except the people who get the benefits, and they tell all their friends that it actually works.
Yeah.